morning, I'm Kim Rozier, acting clinical psychologist. I'll be doing a psychology assessment on Jane Smith Jean. She's a female at the age of 38 years old. The date of the test was 3/1/13. The test was administered by Kim Rozier, acting clinical psychologist. The test to be administered will be the Beck Depression Inventory, the BDI, Beck Hopeless Scale, BHS, and the Beck Anxiety, BA1. Now I'm going to go into a brief synopsis of the reason for her coming into the office. The patient came into the clinic with signs of depression and some unusual obsessive-compulsive disorder. Her depressed feelings have included hopelessness, anxiety, and depression. The following Beck scale and inventory will be given to the client to measure the levels and diagnostic of the hopelessness, anxiety, and depression. Behavior during the interview has been cooperative and presented with appropriate effects during the interview. Her speech was slightly slow, however, not excessively so. She manifests no obvious signs of motor difficulty. The patient was very open and willing to discuss her past and present situations and feelings. Jane discussed the history in a clear and friendly manner. Her mood was somewhat depressed and constricted, but she brightened up when talking of positive experiences with her grandmother. She showed no other sign of formal thought disorder. Jane has been experiencing episodes of depression since the late teens and early 20s. She reported that usually she was depressed episodes every day. Jean has completed high school, and she has recently begun living with her daughter. She has worked for a residential treatment facility for troubled girls and since retired, currently on disability leave for problems that arose in her job. Jane has been abused many different times throughout her life. Her former husband was abusive physically and mentally. She also states that her parents abused alcohol for many years, but has not affected her. Now we're going to go into the results of the testing. Results from the Beck Depression Inventory indicate a self-reported level of depression in a severe range raw score of 32. The patient reports symptoms of depression include depressed moods, crying spells, considerable guilt, fatigue, and feelings of worthlessness. Now, the Beck Depression Inventory is a 21-item self-report questionnaire that assesses the severity of the depression. This instrument is one of the widely used assessment measures in both research and clinical settings. Another test, Beck Hopeless Scale, which is the BHS. The BHS examines Jean's thoughts and beliefs about the future. This self-reported questionnaire consists of 20 true or false items that measures three major aspects of hopelessness: feelings about the future, loss of motivation, and expectations. The hopelessness constructed is a factor in many mental disorders and is highly correlated with measures of depression, suicide intent, and ideations. And on this scale, she actually is diagnostic as moderate, a scale of 13. Now, at this time, this concludes our report on change, and thank you very much and have a good day.